I'm Professor Tony Bjourson. I'm Director of the Biomedical Sciences Research Institute at the University of Ulster. I'm also Director of this new Centre for Stratified Medicine here based in Galvin Hospital. Stratified medicine can be summarised as the right treatment for the right person at the right time. Stratified medicine is used interchangeably with personalised medicine, where the objective is to tailor the therapeutics that are used to treat a particular disorder to the individual or to small cohorts of people in the case of stratified medicine. An example of a project that we work on here at the University of Ulster and the Stratified Medicine Centre would be the treatment of rheumatoid arthritis. Rheumatoid arthritis is a very debilitating disorder where the person in severe cases can be out of the workplace in about 18 months. There's a new family of drugs called biologics, anti-TNF drugs, and they're life-changing and extremely effective in approximately 60% of patients that are treated. One of the downsides is that these new drugs cost between £10,000 and £12,000 per patient per year, but up to 40% of patients don't respond to those drugs. So they're on those drugs for 3 to 6 months before they're deemed to be responding or not responding. So you can see you're wasting 3 to 6 months of treatment of a drug that costs up to £12,000 per year. So what we have done here in the Stratified Medicine Centre in partnership with Randox and the Technology Strategy Board is we are developing new tests that will identify which rheumatoid arthritis patients will respond or won't respond to these new drugs. And that will mean that those that are most likely to respond can be prioritised for those expensive medications. But just as importantly, those that don't respond are not unnecessarily treated with a medication from which they're going to derive no clinical benefit. And they can go on to be treated with more effective drugs that suit those particular patients. In order for the promises of personalised or stratified medicine to be realised, there's a number of prerequisites in terms of expertise that's required. So the sort of individual that's required to research in this field would require to be competent in computational biology, be familiar with informatics and programming, but also be very knowledgeable in pathology and biomedical sciences in general, and that's a really scarce commodity. So what we're doing here, in addition to undertaking the research in-house, we're also training the new generation of researchers and the potential workforce for foreign direct investors by offering an undergraduate programme, the first undergraduate programme in the UK and Ireland in stratified medicine. The major strength of the Centre for Stratified Medicine based in Seatrick here in Galvin resides in the partnership that exists between our clinical colleagues and our academic researchers in the University of Ulster Biomedical Sciences Research Institute. It's very difficult to deliver on these objectives without all these stakeholders working together. So you need the academic researchers that are working on genomics and proteomics and metabolomics, for example, all those omic technologies, working with clinicians who day and daily interact and diagnose and treat patients, and also the patients themselves. So the patients, the clinicians and the academic researchers are part of the partnership, really. And the first projects will focus on hypertension, which is high blood pressure, inflammatory disease such as rheumatoid arthritis or Crohn's disease, oncology, some aspects of oncology focusing on prostate cancer and breast cancer, vision defects, and the development of new therapeutics and diagnostics, partner diagnostics across those disciplines. And it's also really important to realise that each of those areas don't exist in isolation, they're all interrelated. So for example, inflammatory state is important in high blood pressure, and cardiovascular disease, and bone health, and oncology, and in vision defects. So the secret is working across all of those disease areas to focus on common causes, where rather than treating a symptom, you treat the root cause, and that's one of the focuses of the centre and of stratified and personalised medicine as well.